helps as you're oxygenating. It helps the body detoxify. On the same premise, you can add things in that are high in oxygen. Now, wholesome good greens and things like that, chlorella, spirulina, those things that induce oxygenation can also help the body fight off the yeast and preserve the good bacteria. Unlike the nystatins, which destroy all the good stuff in there as well, and then everything goes back to normal as far as having issues with yeast. Quercetin and bromelain. We get a lot of people with yeast that got a little itchy and they get hypersensitive and things like that. When we combine the ester C with quercetin and bromelain, it really does help the inflammatory response and the allergic response to this yeast that we seem to be replicating at phenomenal levels in this country. There are lots and lots of other supplements that work. Caprylic acid, coconut oil that you can do on a daily basis, especially coconut oil on a nice piece of whole grain toast. There's other things that you can do to help maintain and get rid of yeast dietary wise, but I've kind of given you just a synopsis of basically what I know is most common. I hope that helps you. Next, we're going to be moving on to the fitness portion of our show. Thank you very much. Hi, welcome to the fitness portion of our show. And once again, you got me on my knees and on the floor, and I have my 11-year-old son and a friend of my older son to thank for using the ball today in some exercises that may help give you a little bit of relief for back pain. First of all, getting a nice ball that's correct for your body size, and this one's kind of a medium one. It could be pumped up a little bit more. But what I would do with this particular motion is I would kind of just curl my spine around it. Now look, I'm completely supported. I'm kind of like almost doing a yoga move that would be kind of like a cat kind of a movement. But I'm stretching out the erectors, getting my spine, and then gently getting back up again, and then I'm going to flip it, because always remaining in balance, I think, is probably the most important thing. So where we do a positive move, we do a negative move. It's always in balance. And what my son's 22-year-old friend was doing is he was rolling on the ground, and he was just massaging his back. He was kind of laying back here like this. And he got up from my little ball, and he says, I need one of these for Christmas. Because bottom line is his back felt a lot better. But what it was doing is it was massaging, it was getting circulation into the spinal area, and kind of stretching the back out in a very supported way. Anyway, I hope this helps. Experiment. They're very inexpensive, and there's a lot of different exercises you can do with these balls. Next, we're going to be moving on to the research portion of our show. Thank you. Welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
Thank you for the intro. Well, now it comes down to vitamin D again, but this time for pregnant women, especially for the newborn infant itself. Now the question always been at hand is vitamin D safe for pregnant women in large dosages, and how much should they require? Well, researchers made a good determination of how much vitamin D they do require. And this information was presented at the Pediatric Academic Society meeting in Vancouver, British Columbia. How much they determined was this? Well, let's put it this way. They based it on preterm labor, birth, and infections. And they gave a couple different dosages, 400 international units, 2,000 international units, and 4,000 international units. They also tested it for toxicity and potentially any side effects. They found out the best results with zero toxicity was 4,000 IUs of vitamin D per day for the pregnant lady herself. They said, quote, the diet is not providing enough vitamin D. And they also said there were no adverse events related to vitamin D dosing were found in any of the three arms of the study, the 4,000, 2,000, and of course the 400. Now, they said the spectacular part of the study was it showed women replete in vitamin D had lower rates of preterm labor and preterm births and lower rates of infection, said Dr. Wagner, the lead researcher. So, pregnant, plan on being pregnant, do your vitamin D. 4,000 IUs. You're not going to find it in your standard prenatal. If you were lucky enough to see this show, do it now. Because chances are, before your mainstream media picks it up and actually does some sort of news reporting, it'll be long past time. And now, for another one, which you like, and this is especially going to be important to people with chronic obstructive pulmonary disorder. And it's a plant called periwinkle. Why is this weird-sounding plant so important? Well, they found that it's a powerful anti-inflammatory. And the reason this is important for people with COPD is this. Often they only prescribe steroids. The problem with that is steroids were not designed for long-term use. Therefore, having a ton of different effects from creating diabetes, liver problems, so on and so forth. And this is what they said. This is published in the Proceedings of the National Academy of Sciences. They said there is an urgent new therapy, there is a need for urgent new therapies for the treatment of the COPD, as well as ear infections and arterial sclerosis, and any chronic inflammation, including of the arteries. They found what is extremely exciting and promising about this periwinkle is its incredible safety profile. Now, periwinkle, to back up, you may also know it as vinpocetine. If you walk into a health food store, it's been on the shelf for years. So previously, most drugs tested in this area failed because of the lack of efficacy. But they found out that vinpocetine, henceforth, or periwinkle, decreases the inflammation, targeting the activity of specific enzymes known as IKK. IKK is responsible for regulating inflammation. They also said the therapy has no evidence of toxicity or noticeable side effects in human patients. Scientists at the University of Rochester hope to reposition this compound as an anti-inflammatory agent for the treatment of COPD and potentially other inflammatory conditions such as asthma, otitis media, ear infections, rheumatoid arthritis, arterial sclerosis, and psoriasis in the future. Very promising. Again, you know, as periwinkle or vinpocetine can be found in most health food stores, or at least decent ones. Outside of that, now we go down to broccoli. Broccoli has one unique effect that chemo drugs, according to the research coming out of the May 1st issue of Clinical Cancer Research, that chemo drugs do not have. Chemo drugs may kill the cancer or have an effect on the cancer, but broccoli does one step better. It stops the stem cells which produce the cancer, or I should say cancer stem cells itself, because there's a component in broccoli called if I can pronounce right, sulforaphane, which actually they say targeted and killed cancer stem cells and prevented new tumors from growing. Real promising. They said the concentration of this component found in broccoli or broccoli sprouts, otherwise known as sulforaphane, used in the study were higher than can be achieved normally from eating broccoli or broccoli sprouts itself. Another thing that you could find on the shelf in most health food stores. Talk to your oncologist about it, see if it can be a good adjunct, but it gives an extremely powerful extra arm to people going through chemotherapy, and it actually gets to the root of the cancer itself instead of killing cells which are already turned to cancer in its own place. Otherwise, something to definitely look at, and very, very, very promising. Now, let's go to Crohn's disease. How many people want Crohn's disease? Or do you like Crohn's disease? What's your best chance of increasing your risk of Crohn's disease? About, let's say, 5 times over the normal individual. Take aspirin on a daily use. What came out of the Digestive Disease Week conference in New Orleans, they found out that people who regularly take aspirin for a year or more, just a year, increase the risk of developing Crohn's disease according to the new study out of the University of East Anglia. The UEA team followed 200,000 volunteers aged 30 to 74 in Britain, Sweden, Denmark, Germany, and Italy. The volunteers have been recruited for the EPIC study called the European Prospective Investigative into Cancer Nutrition between 1993 and 1997. The volunteers were all initially well, but a number developed Crohn's disease. And the only difference they could find in all the studies was that they were taking aspirin. And they said, quote unquote, they discovered that those taking aspirin regularly for a year or more were around 5 times more likely to develop Crohn's disease. Something to consider if you're prone to digestive disorders. And another thing to consider if you're prone to digestive disorders, especially those with ulcerative colitis. Here's an easy way on the other end to prevent ulcerative colitis if you find yourself prone to it. And this also came out of the Digestive Disease Week conference in New Orleans. The researchers led by Dr. Andrew Hart of the University of East Anglia School of Medicine studied more than 25,000 people between the ages of 40 and 65 living in Norfolk, UK. The volunteers were recruited for the study, and between 1993 and 1997 again. The participants of none who've had ulcerative colitis prior to entering the study at the outset. They completed detailed food diaries and were later analyzed. Well, guess how much reduction in your chance of getting ulcerative colitis were if you were doing a good amount of oleic acid or olive oil? Your chance of reducing the risk of getting ulcerative colitis was reduced by 90%. They're wondering if it even can fix the problem in people that currently have it. So, if you're concerned, they said, quote, we estimate that around half of the cases of ulcerative colitis could be prevented if larger amounts of oleic acid, coming from olive oil, were consumed. 2 to 3 tablespoons of olive oil per day would have that protective effect. Something really easy to do if you have the opportunity to do it, and you should. Olive oil is pretty much everywhere. Now, fatty liver disease. This one's also, again, another vitamin. And this one, surprisingly enough, is vitamin E. They compared vitamin E to a drug called Actos because Actos is primarily given to people with fatty liver disease. It's also estimated that about 10 to 20% of the U.S. population does have fatty livers, even though it's asymptomatic. Well, guess what beat the drug? And I mean beat it bad. Vitamin E. They said, quote, the good news showed that this study showed that cheap and readily available vitamin E can help those with the condition. We also looked at the drug, pioglitazone, which showed some benefits, otherwise known as Actos, but not as dramatic as with vitamin E. After 96 weeks treatment, vitamin E improved all features of non-alcoholic fatty liver disease, with the exception of the amount of scar tissue in the liver. 43% of those people treated with vitamin E actually finished the study compared to only 34% of those people taking the drug. Plus, the drug had one more detrimental effect. Those taking it for 96 weeks gained 10 pounds, while those doing the vitamin E did not. But keep in mind, they had to stay on the vitamin E. And also, last but not least, in the Journal of the National Cancer Institute, the overdiagnosis of cancer. They estimate 25% of breast cancer overdiagnosed, 60% of prostate cancers, and 50% of lung cancers are overdiagnosed. Unfortunately, I'm out of time, so we'll wrap it up there, but thank you very much.
Thank you very much, Ralph. A lot of good information. Thank you. Do your research, try, practice, do what you can to help yourself naturally with no side effects. Have a great day.